Hello everyone, I am Dr. Naveen Polavarpu. I am a senior consultant gastroenterologist and liver transplant hepatologist working at Yashoda Hospitals, high-tech city. Today we're going to discuss about something very important that we see in our clinic on almost on a daily basis, the abnormal liver enzymes or liver diseases. See, there are a number of reasons why liver can be affected. The most common reasons that we see are the alcohol, the fatty liver, and also the viral hepatitis. So there are the three most important reasons why liver gets affected, and because of this, liver gets damaged. Initially, where people would not know that the damage has started. In fact, I would also say here that liver is a silent killer, because unless the liver gets significantly damaged, you would not have any symptoms. So by the time they have any symptoms because of liver diseases like having jaundice or yellow eyes, or having fluid in the tummy called ascites in medical terms, or fluid in the legs, it is too late. So do not wait till that time. Please come and check yourself regularly for your liver function test, so that we can pick these conditions at an early stage and we can help you out, because all these conditions are more preventable diseases, and I think it's in our hands that we deal with this at an early stage before it actually gets worse. So people who have problems with liver diseases, they can present with, as I said, ascites or jaundice or weakness or tiredness. They can also have muscle loss or weight loss, and they can also become drowsy and sleeping for most of the times, and sometimes they can also present with blood vomit or having black stools. So if you do have any of these problems, do not hesitate, and you should get yourself checked by the liver specialist at an early stage as soon as possible. So please do consult us if you do have any problems with liver related diseases or liver related conditions, and we can help you out. Thank you.